In this video, we're going to demonstrate IV push medication through a peripheral line. This can be done with either a running infusion or an IPID. So the first thing we want to do is we want to go ahead and we want to wash our hands. We want to wash our hands prior to entering the patient's room and use hand sanitizer when entering and exiting the patient's room. The next thing we're going to do is we're going to identify our client. We're going to just have them tell us their name and date of birth, and at this point we're also going to introduce ourselves. So I would say, my name is John, I'll be your nurse. Next thing we want to do is provide privacy by closing the curtain or closing the door of the room for the patient. We're going to explain the procedure, just let them know that we're going to administer a medication that the doctor ordered or a medication that the patient had requested for something like pain or nausea. And then we also want to ensure that the situation is safe for both the patient and myself as their nurse. Next thing we want to do is we want to go ahead and check the doctor's order, and we'll go ahead and check that on the MAR, which is found in the patient's chart. So after we've checked the MAR, we're going to go ahead and look at our patient. We're going to ask them if they are allergic to any medications, and then from there we can just go ahead and start looking at our medication itself. The first thing we like to look at typically would be the drug, so whatever specific medication it is. We're looking at the dose of the medication that we're giving. We want to look at the integrity of the container, the color, the clarity, the concentration of the medication. We also want to check the expiration date. So at this point, we're doing our first check. We want to make sure we've checked the 6 patient rights, which include the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. Again, at this point, we're just double checking allergies, asking the patient, and verifying that on their chart. So, next thing we want to do is with the medication, we can use the mnemonic, the P card, which the first thing we want to do is for P is we want to check the peak of the medication. So how long will it take this medication to actually work or kick in? Will it be 5 to 10 seconds after we administer it, or will it be 30 minutes? The next thing we want to do is check compatibility. Checking compatibility is good because we want to make sure that if we need to dilute the medication, or if a patient's getting a medication with another primary infusion, or if they're getting an antibiotic, we want to make sure that it's just compatible with whatever else we're giving. Again, we've checked the allergies, so that's the A. R would just be the rate at which we're going to give the medication. Now for this, I have a 3 ml syringe, which brings me to my next topic. We want to make sure we have the appropriate size syringe for the amount of medication that we're giving. In this case, an example, and this is just filled with sodium chloride, I have it to 2 mLs, which is actually in a 3 ml syringe. This is appropriate for this amount of medication. If it's 5 mLs, typically we can put either a 5 ml syringe or a 10 ml syringe, so on and so forth. We just want to make sure we have enough space once we withdraw it out of the vial. So, once we've done that, we'll put that to the side. Here we have our supplies. So I want to make sure that I follow standard precautions. I have my PPE, so I have my gloves. Most likely we'll have a mask on because we're in the hospital. Eye protection if needed. Okay, we have our IV site here. We want to go ahead and just assess the client's IV site. We want to look for phlebitis, which would be any type of inflammation around the vein. So we're just palpating around the area, asking if it's tender, looking for any kind of warmth. So we're looking at heat, any redness, swelling, or obviously pain. Typically, we'd also assess for infiltration. Around the site, if you notice any infiltration, you'll notice swelling, but it'll be either pale or what they describe as a pallor color, which can even be somewhat of a gray. And then it'll also have pain in that area as well. So the swelling, the pallor, and the pain. And that could be from fluid extravasating in that area, or it could be the catheter has gone through the vein, or just because of the site, if the patient moved, if the IV had caught onto something. We just want to double check that and verify, and we'll verify with placement as well. So, we've checked our medication the first time. We're doing that. Typically, we'll do that at the Pyxis before we enter the patient's room. Now at bedside, we're going to go ahead and do our second check. When we have our medication, like I said, this is already drawn up. We want to go ahead and make sure we're going to administer this at the correct rate. So we have that here. And I'm going to go ahead, I'm going to open up I have a 10 ml syringe, so a flush, I'm going to go ahead and prepare that. And all that is just hooking it, taking it out of the container. And then I'm going to take the cap off, and then we're going to just break the seal in that, and I'll demonstrate that in a minute. First, I'm going to go ahead and put my gloves on. Okay. Next, we're going to go ahead and open up our alcohol prep pad. We're going to take the hub of the lock, and then we're going to go ahead and scrub this for 15 seconds vigorously. So typically with medication, in the syringe there, we do have 2 mLs in the 3 ml syringe. We want to keep a cap on this and make sure it's clean. This syringe should also be labeled with whatever medication is in it. You can also put your initials on and the date and time. So, for example, we would say that this is the typical medication could be with 2 mLs would be, for example, ondansetron or Zofran. And Zofran comes in 2 mLs, which would be 4 milligrams, and the order would be for 4 milligrams, and we want to get the 2 mLs over 1 minute. So in order to do that, we're going to go ahead and push 0.5 mLs or a half every 15 seconds. We're going to do that over 15 seconds. So, and I will demonstrate that. So what I'm going to do is I'm keeping this clean. I'm going to remove the cap from the syringe and the vial. Again, we've done our third check. We checked our 6 patient rights, the right patient, and their allergies. And again, we checked it against the MAR. We're going to go ahead and attach this syringe to the lower lock. Turn it so where we can see. And then I'm going to give this over 15 seconds. Again, this first one I'm giving over the first 15 seconds is just the 0.5 ml. And then I'm going to continue. Okay, keeping an eye on the time, making sure I'm giving this correctly, monitoring the patient for any changes. Okay. I time that to be done at 8 minutes and 5 seconds, right at the dot. Okay. Now, removing that. Next thing we're going to do is we're going to take our 10 ml flush. And for this, we're going to go ahead and make sure we get all the air. I don't know if you can see the air pocket there. We're going to take the air out of this syringe. And the way to do that, there's a seal up top here. So what you do is you just aspirate by pulling back on the plunger, holding that straight up, pulling back a little bit, and I'll break that seal. And it's going to push the air out of the syringe, removing all air from, making a little bit of a mess there. And if it is, you can just kind of, if you flick it and make the needle go to the other end, so that way it's clear up top. I'm going to do, this is still clean since we haven't contaminated it. We're going to reattach our syringe. And then this first ml, we're going to give over the 30 seconds, I would suppose. Let me see here. I don't think that's, we want to give that first ml at the same rate. So we're going to give half an ml over 15 seconds. And double check my time there. At the same rate. Now, what we're going to do is then we're going to push the rest of this in. When we flush, and you can go at a slow, steady rate when you want to just do a flush, and you're going to flush 2 to 3 mLs. Okay, that's in. Go ahead, once we flush our 2 mLs, we can remove that. And this can either be capped, or you can leave it to as it is. Just make sure that when you do that, it's going to, you're going to clean it for 15 seconds prior to administering fluids or medications. All right, this doesn't stick too good on the artificial arm. But now that you've gone ahead and you've administered the medication, you want to go and just document document all of your findings, your administration, and then reassess the patient as appropriate. This concludes the video for IV push medication through a peripheral line. Hope you enjoyed.